Welcome to Home Health 360, a podcast presented by AlayaCare. I'm your host, Jeff Howell, and this is the show about learning from the best in home health care from around the globe. Hey listeners, today's pod is all about self-directed care. If you're interested in expanding your service lines to include family and friends to help deliver better and more care, then you'll be interested in listening to today's guest, the VP of CDPAP services at Community Care Home Health in New York, Megan Shergill. Thanks for being here today.
Thank you so much for having me, Jeff. It's a true pleasure, and happy Friday. I don't know if your listeners know it's a Friday. Fridays are always happy. Thanks for having me.
And it's sunny and warm out, and it's a long weekend where I live, so it'll be a nice, good long weekend. Well, tell us a little bit more about your career path, Meg.
Oh, sure. Well, first, I just have to compliment you. You pronounced my last name correctly, Shergill, as in sharing information, but right? So that's typically what I was born to do. So when people ask about my career path, my next question is typically, how far back do you want to go? But I'll condense it for the purpose of this conversation that we're having today. So as mentioned, right now, the title is Vice President of CDPAP Services, which is an alternative home care program to traditional home care services at an organization called Community Care Home Health Services. We are located, our corporate office, where I'm speaking from today, is in Smithtown on Long Island. However, we service all of Long Island, Westchester, the 5 boroughs of New York City, Monroe County, and Erie County. And come April, we anticipate to service an additional 20 counties throughout New York State. So I think that your listeners will be very encouraged to know that the breadth of our territory is about to be quite enormous. So we can help a lot of people. And now to go back to how my career path started was, if we're being honest, when I was 10 years old, graduating from 5th grade elementary school, my art teacher at the time identified me as a good candidate to volunteer at a special needs summer camp for children with special needs, teaching them art and music. So then for the next 5 years during that summer camp, I obviously developed relationships with families and those children with special needs. And then for the next 5 years, and then one of those families really connected with. As I turned 15, 16, they actually asked me to start babysitting their child with low functioning autism, which we both knew was going to be a challenge. But because I suppose I did a good job in that classroom setting, they wanted me to be in their home assisting them. So then from 15 to about 18 years old, I then at 18 got certified to be titled as something called a community habilitation specialist. Have you ever heard of that before, Jeff?
No, especially at that age, no.
So community habilitation specialist, their role is to go through different activities of daily living with that individual, the child, and to try to get them to get towards as much independence as possible, completing their activities of daily living, using things like gesturing, verbal prompting, and then like physically completing if they're not able to actually do it. So that was my role as a community habilitation specialist. Once I got certified at 18, I then started working for an organization called the Center for Family Support. And I actually ended up having a roster of different families that I would work for throughout the week beyond that just one family. And then from there, I transitioned to an organization called the Developmental Disabilities Institute in Suffolk County, Long Island, which is a residential facility for children from 13 to 21, meaning that my role was to get them ready for school from like 6 a.m. till 9 a.m., doing all of their activities of daily living, like grooming, dressing, showering, bathing, toileting, things like that. And I worked there for a couple of years, but to be candid, there was burnout. The burnout was real because it's very physically hands-on. And these children, although identified as children, I'm not joking, one was 6'4" and little 5'6" me, petite, it was taking a toll on me, So then I segued into looking into the home care space so that I could better help a better volume of families in an administrative role rather than physically helping them, just knowing that I couldn't keep it going. So then I segued into home care, and I was blessed to start entry level as a scheduling coordinator, meaning that I was the person scheduling the home health aides to go into people's homes. And then I was blessed to be mentored by the COO at the time to then kind of raise me through the ranks to then be a manager, an administrator, a director, an assistant vice president. And then today here I stand as the vice president of the program that I have the most passion for, CDPAP, here at Community Care.
And CDPAP is really a New York specific term. Can you bring us through what the acronym stands for?
Of course. And I like that you said that because I have some fun dinner party facts for you that we can dive into for a second. But yes, so CDPAP stands for the Consumer Directed Personal Assistance Program. And that usually goes over people's heads because first they think, is it the same as a CPAP machine? Which it is not. And then they hear terms like consumer and personal assistant, and it still does not quite register with what that means. So generally speaking, I like to paint a picture. Picture Mrs. Smith. She's considered to be alert and oriented, and she wants to have more control over her home care services, meaning she wants to be the boss of her home care services. In this program, she, Mrs. Smith, would be known as the consumer. She's then allowed to find her own caregivers, personal assistants, known in this program, train her caregivers, monitor the work of her caregivers, and coordinate the shifts of her caregivers. And she could hire just about anyone as long as they are at least an adult and eligible for employment in the United States. There's only just a few exceptions. She can't hire her legal spouse to be her caregiver for obvious reasons, conflicts. But beyond that, there's very limited limitations on who can be her caregiver because New York State Department of Health policy and regulations states that in CDPAP, there are no drug screens required and no background checks required. Now, different agencies have their own internal policies that sometimes implement those things, but Community Care is a firm believer that the consumer, they have their choice. Meaning if Mrs. Smith wants to hire her adult grandson, who perhaps does have some type of criminal history record for doing something stupid when he was young, she can still hire him. And people tend to be a little bit polarized in regards to, different types of drugs, like one way or the other. But at least in this program, the consumer takes on the responsibility of choosing whether or not to trust someone to be her caregiver. And the beauty of it is that it allows the consumer, like Mrs. Smith, to be the boss of her home care services. And then the next question people often ask is, so what does the home care agency, known as the fiscal intermediary in CDPAP, actually do if Mrs. Smith is doing everything else? Fiscal intermediary. We are solely responsible for enrolling families into CDPAP, making sure that they know the rules, regulations, and responsibilities, and we monitor them on a certain frequency to make sure that they know and are still abiding by those rules and regs and responsibilities. And then we process the payroll for the caregivers so that Mrs. Smith can wipe her hands clean, knowing she's being the front of the head boss, and we're just simply the back end payroll processors. So to go back to my little fun dinner party facts, you mentioned that New York State's term for this consumer-directed home care model is CDPAP. But do you, Jeff, know which state in the United States, because all states now have a consumer-directed type of home care program, putting you here on the hot seat, what do you think is the state with the highest volume of consumer-directed home care services?
Well, listen, Megan, I'm the one that's supposed to be asking the questions around here. But let me guess. I'm going to say it's got to be a state.
Take a good guess.
Okay. It's not going to be an obvious state based on population. It's going to be a state that has really jumped into self-directed care. If I didn't think that this was a trick question, I would guess New York, just because I've seen CDPAP everywhere versus other states. I think no one has actually branded a term of their own, and they're just using the generic self-directed care term. So I'm going to go with New York.
Good guess. So CDPAP, or the Consumer Directed Home Care Model, started in New York State in the 1970s by a group of individuals who were physically disabled, who literally sat around a round table. So they had diagnoses like MS, or they were paraplegics. So they were alert, just physically disabled. And they said, we want to be your own boss. Get the home care agency less involved. So it started in New York State. That's where then I'm disheartened, because it's actually not the highest volume state to have the consumer directed program. A lot of people guess California because it's a very progressive state. A lot of people guess Florida because of the high geriatric population, but it's actually Washington state.
Oh, interesting. And Washington is pretty far down the list in terms of population. Yeah.
Exactly. And another fun dinner party fact is I'll just tell you, Australia is the only home care offering that they have for individuals is the consumer directed home care program.
I am well familiar with that. They're probably the leaders in the world in that regard, where you get a check and then you decide how to spend that money through. It's a popular program, and in fact, there can be things, for example, installing an air conditioner could qualify as a way to direct those funds, as an example. So.
And in California, their program is not called CDPAP. It's actually called Bring Your Own Caregiver, BYOC, which I think is cute.
Oh, okay. I'm learning some new things. I'm going to write that down. BYOC. I did not know.
This is why, Jeff, people call me the CDPAP girl.
Yeah.
Is because this is why I'm so passionate about this program, because it disheartens me knowing it started in New York State, but not enough people seem to know that it's an option available to them. And you and I know not everyone's right for this program, so it's good for them just to at least know it's an option.
You've kind of gone through that experience yourself with you being the 5th grade caregiver too, right?
That's right.
If I'm a family at home and I'm just discovering home care, and then my mind is blown about how we can have, cousin Tommy provide care, what steps do the families take to affiliate themselves with a home care agency? I'm assuming they pick one home care agency to be the fiscal or the financial intermediary. Like, how does it all work?
It's a hard question to answer, because every family or individual, as I'm sure you know, kind of starts at a different starting point. Being some people are not yet even approved for Medicaid. And this is a Medicaid-funded home care program. So they first have to have Medicaid, and then they have to go through an assessment process, because just because you're approved for Medicaid, I'm going to use Mrs. Smith again as an example. Mrs. Smith is approved for Medicaid, but that does not mean that she's automatically going to get approved for home care services, which can be considered to be like a community-based home care program, right? So there's an independent organization in New York State called NYIA, NYIA, the New York Independent Assessor. So what my team and myself, our goal is to help walk people through that process of, okay, you've been approved for Medicaid. Now you or your family have to call NYIA to schedule an assessment to see if, one, you're eligible for home care services, because you and I know one can safely receive care at home. And two, how many hours will get approved on a weekly basis, because it varies. Because what the nurse assessors are doing during these assessments is calculating how much physical assistance Mrs. Smith needs for each activity of daily living. And then each task, like toileting, for instance, is accrued to a certain amount of time. So let's say that the family has proven that Mrs. Smith needs physical assistance with toileting. I don't know the exact numbers, but let's just say that is then it coincides to 15 minutes. If Mrs. Smith toilets 8 times a day, times 7 days a week, that's then how they start grouping how many hours they're going to approve for her. So once then they get approved for home care services, there's a couple different paths. A geriatric individual typically gets enrolled into their local Department of Social Services for the first 3 months or so. And then they're prompted to enroll into a managed long-term care plan, an insurance plan, which then takes over paying for the home care services. Now, on the flip side, if it's an individual with special needs that's typically enrolled into what's known as an OPWDD waiver program, or a TBI waiver program, then that individual is always enrolled and will stay enrolled into their local Department of Social Services as the home care payer source. So whether it's the geriatric individual under an MLTC, a managed long-term care company, or a special needs individual getting the home care services paid through the local Department of Social Services, at some point, they'll be prompted to choose a home care agency and a type of service. That's then when those professionals are supposed to be giving them the option of choosing traditional home care services or CDPAP services. And in my experience, I've found that they're not often educated about CDPAP being an option. So that's why I do a lot of these speaking engagements, a lot of virtual presentations. You and I are LinkedIn now on LinkedIn. You see, I do a lot of virtual events, a lot of in-person events, just so that people know it's an option, because it's very disheartening when they don't realize that they could have more autonomy, privacy, and independence using CDPAP.
Sure. Yeah. And I would suspect, these are situations where there are family caregivers that are providing care anyways, and it's a good opportunity for them to be compensated for it.
So here's an example, if you don't mind me just peppering in. Say, Jeff, you work your 9 to 5, but just generally speaking, you check in on your own mom after business hours to make sure she's got a warm meal, to help bathe her before bed, and then put her in her PJs, tuck her in at night. You could get clocked in and get paid for doing those services through CDPAP. It doesn't mean you need to be mom's primary caregiver. You could hire someone or, someone else, whether mom or someone taking on that responsibility of being the boss. If she's not self-directing, can choose to hire other primary caregivers. But if you're already doing that, it's a win-win. And then for the special needs population, a lot of people don't realize that once a special needs individual is 21 years old, their parent can get paid to be their caregiver, which is, they've been doing this labor of love for years. Let them get some type of compensation for doing so.
Yeah, for sure. The general public really is only the pandemic actually shone a little bit of a light on home care. But, CDPAP or any other self-directed care where family caregivers would really just have no idea about these programs. How many agencies would you say? I think there's about 1,400 LICSAs. So those are the Medicaid agencies in New York. What's your estimate of how many of those would have CDPAP programs?
You've done your homework, Jeff.
I like to throw out a few facts every once in a while to make it seem like I know what I'm talking about.
You also have dinner party fun facts. I love it.
That's right. Yeah, we should go to the same dinner parties.
We should. We'll be like a live with Regis and Kelly, and we'll just be rifting together. Okay, so to go to your point. My total was about 1,300 LICSAs, but you're probably right. It grows every day. As you know, not every LICSA, a licensed, what does it stand for again? Licensed Home Care Service Agency, a LICSA. Because I used to say that to my parents, and they say something like, "What you saying now?" Yeah, Licensed Home Care Service Agency. Not every LICSA has a CDPAP FI, so you can't directly correlate it to them. But the last count in about 2017 that I saw that we foiled the information that was published said that there was about 800 CDPAP FIs in New York State alone, which to me is mind-blowing because you definitely know, Jeff, as of a few years ago, around 2019 or 2020, before then, there was no application process or registering process or certification process to start up a CDPAP FI. So, Jeff, I literally could have just said to you, Jeff, you want to open up a CDPAP FI in my basement? Sure, let's do it. And
let's just put it on the website.
New York State Department of Health, exactly. New York State Department of Health would be none the wiser, which is terrifying because I just got off the phone literally right before this meeting that we're having today with a family member that said the other agency that I spoke to sounded so sketchy, so car salesman type. They didn't know the rules, the regs, etc., because there was no application or certification process, which scares me because then they're not on New York State Department of Health's radar, meaning that they're not getting audited. What happened then, perhaps if I can segue, is New York State implemented something called an RFO. I forget what year. It was either 2019 or 2020. RFO, tons of fun acronyms. Am I right? the request for offers. So
Yes.
they implemented this, New York State Department of Health, basically saying that any CDPAP FI that wants to remain in business providing CDPAP services must complete a lengthy application process, including a thesis of best practices, meaning like why New York State should choose them to be one of the remaining CDPAP FIs. And when I'm talking thesis, Jeff, the one that I wrote was about, with the help of the COO at the time, was about 400 pages.
Oh boy.
We put our blood, sweat, and tons of tears into that.
Right.
Exactly. But then, wait, Jeff, there's more. As we know, New York State Department of Health tends to change things quite quickly. So we submitted it, and then the pandemic happened. So understandably, they kicked the can in regards to who they were going to award to be the remaining 60 or so CDPAP FIs, which is understandable. Once the height of the pandemic died down a little bit, then they revisited. They then awarded about, I think it was between 62 to 68 CDPAP FIs. However, they did not make it public as to the criteria of how they chose them, which, as you can imagine, for the 700 plus other FIs that weren't chosen, there was an upheaval. Let's see what your criteria was. Why did you choose A, B, and C agency over us? So then, wait, there's more. New York State Department of Health said, "You right. You're right. We didn't make it clear what the criteria was going to be. And instead, let's renege on the whole RFO. And instead, if you can prove that you were a CDPAP FI that serviced 200 consumers in one county, I believe it was of the year of 2019 or 2020, don't quote me, then we'll award you permission to move forward as one of the remaining FIs. There were two criteria. It was either servicing 200 consumers in one county or servicing, I believe, the boroughs, something like that. Does that sound familiar to you, Jeff?
I'm not familiar with that, but it makes sense that you have a criteria of existing volume that you're servicing. I could see that as being so. At the end of that, what was the shakeout? If there were 62 to 68 before, and then when they rebooted this, where are we at now?
They said around November that they would announce the awardees January 1st. Do we know what happened January 1st? They kicked the can. And now they said that they're going to announce perhaps mid-April. So we just wait. We do our best practice. And what we do is I continue to do things like this, is educate the community. And I don't know if you've gotten a chance, Jeff, to go onto Google and search community care, home health services, Smithtown, which is our corporate office, because we have so many offices. But if you search Smithtown, you'll see, as of last night, I believe we have 139 reviews with a 4.6 out of 5-star rating. And we're very proud of that because, as you and I know in the human services industry, that people tend to only leave poor reviews. No one really goes out of their way to leave good reviews. And you can't pay for these reviews. These are genuine reviews from community members. So when I educate people about CDPAP, I always say, I let them know the lowdown about the sketchy FIs out there who don't right now always follow the rules, regs, and regulations and get audited. And the great thing about community care is we are also ELIXA. So we know that at least on an annual basis, New York State Department of Health, as well as different insurance payer sources, will come into our offices and audit our files, which is an open door policy because we're doing things the right way. Whereas an organization only providing CDPAP services may not be doing things above board, so to speak, or above bar, so to speak.
Got it. So circling back to a family taking the very first step, no one would know to Google CDPAP New York. So that if they arrive at home, like they Google home care plus their local geography, maybe they'll land on one of the companies that actually provides CDPAP. Most people wouldn't know about the NYIA, and I suspect that's not the first step for families to take. If you're a family, like if you're advising a family on what they should do as their very first step, say they're listening to this podcast and like, oh, I had no idea that there's this consumer-directed personal attendant program. Yeah, I provide care for mom. What's the very next thing that I should do?
I would recommend, selfishly, I would love for them to call myself or our team just to learn more. But honestly, for them to do their due diligence, searching terms in Google like CDPAP, New York, look through the different agencies, make sure that they're more mission driven rather than just trying to get your business, because our team is mission driven and fueled by just trying to be advocates and educating the community. Because I can't tell you how many people I turn away, Jeff, when I realize that perhaps this is not the right program for them, simply because it requires a lot of organization and oversight and like a type A personality. I don't know if you picked up, I am a type A, so I can say that. But if you're easily overwhelmed, this is not the program for you, and that's fine. But that's so great because then we also have that traditional home care side that I can offer a warm handoff to. But the average person should be doing their due diligence, looking on the social media platforms of the agencies to make sure that they are educating, that they've got great Google business reviews, and talk to other professionals in healthcare, meaning if you're working with an elder law attorney or a Medicaid specialist or a special needs advocate, something like that, ask them who they trust, because I would be very surprised if they didn't mention us. Quite honestly.
Yeah. I can independently verify I'm seeing 139 Google reviews at a 4.6 rating. So
listen, I'm prepared, Jeff, and I look at that every day.
Nice. What do you see as the trends that you think are going to emerge, Megan, over the next few years with the program?
I'm hopeful that New York State Department of Health will be true to their word and choose the remaining CDPAP FIs like they've expressed, because we already submitted our what's known as an attestation, proving that we serviced over 200 consumers in one and more counties at that time. So I'm hoping that they just don't, shift gears and change their minds for whatever reason. But regardless, I really do hope that they reduce the amount of CDPAP FIs. However, that they don't reduce it to only one, because you can't have a monopoly and you have to have consumer choice. Are you familiar with what CCOs are, Jeff?
I'm not.
So CCOs are it's an acronym, Care Coordination Organizations, and they are essentially case managers for typically the special needs population. And years ago, maybe like a decade ago, New York State Department of Health did the same type of RFO process because there were too many CCOs, and they were pushing to have only one remaining CCO service all of New York State, which is not right because consumers deserve choice. So what instead they did was they approved 7 remaining CCOs, and at least for every territory, there's at least 2 to choose from. Meaning like there's some overlapping territory, but for every territory, there's at least 2 to choose from. So I'm hoping they do the same thing, maybe a little bit more volume, but for the CDPAP FIs, just to make it fair for the individuals and families we serve.
And I think it's pretty rare. There might only be a couple of companies I can even try to think of that their main business is CDPAP. Like I would tend to think it's most people are in the Medicaid personal care space, and then they've added being an FI for CDPAP on the side, and it's a small priority for them. Was that what you would put as the general landscape?
I think it's a healthy mix, to be honest with you. There are some of those LICSAs that just do CDPAP kind of like as a side gig for people who want that independence. But then I don't want to mention any names. There is a huge CDPAP FI that actually has very poor ratings on Google, but has a lot of radio commercials and TV commercials. And their only business is CDPAP. But again, part of what our team does is we always jot down the feedback from families that transfer from different FIs to our FI. And the trend that we're seeing is either the other FI is not responsive, not accessible, or they promised the caregiver a high pay rate, But even though they offered them a very high pay rate, that caregiver is not getting paid timely or accurately. So what's the sense in getting an extra dollar or two an hour if you're not getting paid timely or accurately? So we jot all this information down. And then on our weekly team meetings that myself and my manager just held with our team today on Friday is always, how do we elevate? And actually that was our word of the month for last month, was the word elevate. How do we become better knowing this? And I personally conduct weekly surveys with our caregivers and our consumers to get their feedback to improve our best practices. And because I know you're wondering, on my whiteboard to my left right now, the word of the month for this month is love, because of Valentine's Day and because we love what we do.
That's great. It's also my mother's birthday, so I never forget to call her on her birthday.
No way. Oh my goodness.
Yeah, it's easy to remember. So question for you on some of the challenges with the program. Like I would imagine with electronic visit verification and you have these family caregivers, there's the potential for cousin Sally just not to show up and then for the client not to say anything. I'm curious how the FIs really help to try to manage compliance and crack down on fraud.
So obviously I can't speak on behalf of other FIs. And I do think that this program just as a whole is wrought with Medicaid fraud and kind of some shady business from both sides, from families and FIs who are trying to bill Medicaid. And there's been a lot of news as of late of people getting caught, which is why I'm proud to say that we are also ELIXA, because we know we're going to get audited. So I don't know how much of your audience knows, but there's actually a federal law called the 21st Century Cures Act that was implemented a year or two ago, I believe, which requires that any Medicaid program make it mandatory for the caregivers to clock in and clock out using electronic visit verification. There's two ways: either clock in and clock out using Mrs. Smith's home phone, using a toll-free number, or they can use their personal cell to use an app that's got a geolocator to verify the GPS location. So that's required. And there's no ifs, ands, or buts. That's a federal law. So all of our caregivers are required to do that. And do we get a little bit of pushback in the beginning? Of course. But then we explain to them that if they use that, they will get paid timely and accurately. So once you explain that to them, rather than mailing in a timesheet that could get lost with the USPS, now they've got buy-in. In addition to that, our team does two additional things that some other agencies may not do. We do what's known as monitoring visits. So some of those monitoring visits are essentially spot checks done via telephone. And the beautiful thing about CDPAP is that the consumer has the right to change his or her schedule week to week, as long as they don't go over the weekly amount of approved hours. So it's hard for us to spot check telephonically, because I could call Mrs. Smith and she could say, oh, Cindy Lou usually comes on Fridays, but we actually changed it to Saturday this week. So it's kind of hard to spot check in that way, but still we do these monitoring visit reports for a couple of reasons: to make sure that they're still aware that their caregivers must use electronic visit verification, to make sure that the consumer is still alert and oriented, and if not, that they have someone designated as their designated representative to take on those responsibilities. And that 3, they still understand the rules and the regs and the responsibilities of the program. So we do that telephonically on a certain frequency, as well as we have our field representatives go into consumers' homes to also assess the environment, assess the alertness of the consumer, if they're considered to be alert, and to check in the caregiver to make sure that they understand how to use EVV.
Right. Love it. And I'm sure all of that really helps contribute to your 139 Google reviews. For the consumers listening at home, the Cures Act was an Obama era piece of legislation that put a deadline on all Medicaid visits to be clocking in and clocking out, right? Because no one's late on a paper timesheet and they've always made it there. And that's rolling out into the Medicare space. But within CDPAP, although the caregivers are typically neighbors and family members, they still have to abide by having a mobile app on their phone to clock in so that the fiscal intermediary can understand that someone was there for the visit and when they clock out as well. So Megan, we're bumping up against our time here. I'll get you out of here on this question. Give us a reason to be optimistic about care delivered in the place where clients call home.
Well, I never want to rush a conversation with you, Jeff. You rushing me out. I don't got places to be. I'm just kidding. I got work to do. It's a
My
Friday.
kids are home and they're on Netflix, so
No, but Jeff, it's been a real pleasure. Reasons for people to be optimistic about the future of care at home is, I don't know about you, but when I age, I want to age in place. I want to still have independence, privacy, and autonomy directing my own care. So you know when that time comes, whether I'm in California with the BYOC or New York State with the CDPAP, I want care at home. And I think the pandemic really brought to light, there's nothing wrong with a facility setting if it's most appropriate for individuals. But if an individual has the ability to safely receive care at home, I think we can all default to saying that's really where we would prefer to be. And the great thing about the consumer-directed personal assistance program is that its purpose is to keep individuals within their communities, not just their homes. We're talking running errands, escorting to medical appointments, going to festivals, going to the movies. Like, it's meant to keep them infiltrated. And I think that after the pandemic, we saw a huge rise in almost like PTSD and loneliness with especially the aging population that really required a lot of companionship. They didn't see people for a long time. So CDPAP, part of the scope of practice is, of course, companionship, as well as the physical assistance of activities of daily living. So I think that everyone kind of saw the trend and the writing on the wall that home care is probably the way to go. And if you haven't mentioned it enough times already, Jeff, I really just encourage your audience to consider reaching out to me for whatever questions they have about home care in general, because I've lived in the special needs community. I've lived on the LICSA side, and I'm currently living in the CDPAP realm. So I'm well versed and I'm fluent, and I'm always happy to help, even if they don't choose our organization.
Yeah, sure. So Megan's a regular user of LinkedIn as well. So in the show notes, you can see how her name is spelled and find her on LinkedIn. And what's the website for your company as well?
Sure. So it's Community Care, H as in Harry, H as in Harry, S as in Samantha.com.
Great. Well, Megan, I took 3 pages of notes here. I am privileged to be able to mingle with some interesting people in the industry. I have to say, this is the most niche and revealing topic that I've had. We certainly got enough acronyms in, so I learned a few new ones today. And I want to thank you for coming on. This has been an outstanding episode.
Jeff, can you write that down and put it on a plaque on my wall? I would love to get that feedback. That people can see it.
I'll put it on the Google reviews.
I was going to say, if you don't mind, it helps. I always say it helps families and professionals make better, well-informed decisions in regards to home care services. So yes, if you don't mind. Thank you so much, Jeff.
Okay. All right. Thanks for coming in today. Thanks, Megan. Take care.
Home Health 360 is presented by AlayaCare. First off, I want to thank our amazing guests and listeners. To get more episodes, you can go to alayacare.com/Home Health 360. That's spelled Home Health 360, or search Home Health 360 on any of your favorite podcasting platforms. The easiest way to stay up to date on our new shows is to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. We also have a newsletter you can sign up for on alayacare.com/Home Health 360 to get alerts for new shows and more valuable content from AlayaCare right into your inbox. Thanks for listening, and we'll see you next time.